a tiny bit.
Oh, maybe
Sure.
No.
Oh, you just scoot your chair over, but not your ass. Good morning. I'm blessed and grateful to be in recovery. My name is Dr. Felice Cellini, and this is our Why Wait for Recovery Sunday morning recovery community meeting.
Hi, good morning. My name is Haiti, and just bear with me, I'm still waking up. I'm a compulsive overeater, I am a binger, and I'm a purger, and I am a food addict, drug addict in recovery.
And I am an alcoholic, anorexic, drug addict in recovery, which is the important part, right?
Exactly.
Is the recovery part. Good morning, everybody.
So we get together, we have our community meetings. They're free for anyone who is struggling or got questions or looking to be in recovery or stay in recovery. And we discuss the solution and how we go and what the next step is, essentially. You can join in the conversation. We are just friends in recovery. This isn't any structured program other than ours. People join us in our virtual waiting room, and you can hop on now, go to whywait.net and jump into the learning opportunities so you can be heard. And also you can either live stream us on Facebook or on YouTube.
Okay, and real quick this morning, first of all, when you said that we're not kind of structured, we're not affiliated with AA or NA or any of the A groups. Shout out to everybody who is awesome groups. Real quick before we start this morning, Anjali and I were having a discussion about a back discussion that we had before. And you guys, I'm just going to put this out there. Starch isn't a food group. Look at your food groups. Starch is not a food group. Carbohydrate, broccoli is a carbohydrate. Cauliflower is a carbohydrate. Strawberries are a carbohydrate. Those don't change your blood sugar. They're not starches. Starches and sugar are not a food group. Yes, you can live without having starch and without having sugar. Just want to make that clear.
Awesome. Thank you
then.
for the clarity.
And I think that we should go around kind of early
actually,
today.
we started something on Thursday, and we said
did.
we'd touch on it today. And the question was, my addiction is not worse than yours. Essentially, I mean, when it comes down to it, you know, the consequences for me using are very different than the consequences for you using.
Right. Physically. So let's do that. Physically, the consequences of me using is a lot different than the consequence. Meaning, me as a drug addict or an alcoholic, it looks a lot different physically when I use than it does if you eat 63 Oreos.
Okay, let me qualify that. So immediately, it's going to look differently. Over time, it's going to look just as bad in a sense, because I'm going to become just as sick. But it just takes a little bit longer, and spiritually I'm just as sick. And
as quickly.
Right, just as quickly, and that obsessive compulsive thinking happens immediately. I mean, that guilt, that shame, that demoralization happens for both of us at the same time. But the consequences, the fear that I would feel if you used is very different than if I tell everyone that I slipped.
Right,
and fell into junk food, okay, or slipped and fell into starches, or whatever it is. You would have a very different, people would go, they would react differently.
Yeah, and so we said that. And so we're going to talk about our differences and our sameness. And I'm just going to tell you, as you said, Haiti, is that, yeah, physically or immediately, I can eat 400 milligrams oxycodone and OD and die. And you can eat your 63 Oreos and not OD and die, just want to die. And so spiritually, how I feel and how you feel after we use, I would imagine is pretty much the same.
Right, and also, you know, the other thing to consider is if you use, you lose your license. I use, no one knows the difference. No one smells the cookies on my breath.
Right.
Or no one, it's not going to change my behaviors. I mean, I might become a little bit more introverted and start isolating, but it's a lot easier to see someone who's using drugs or alcohol when we are fucked up.
Right, and maybe sometimes it's easier if the consequences are worse. Maybe that's easier. Maybe everybody knows if I'm drunk and nobody knows if you binged or if you're throwing up.
Right, so I think really one of the key things in this is we can step into a meeting and be judgmental instead and go, yours is worse than mine, or what you're saying I don't do, or why. Or we can look and identify, because that's where the learning, I honestly believe, lies, is that's how we grow and learn and be able to say, you know, I've done that before. You know, you may be an alcoholic, drug addict, being a sex addict, whatever the story is, but I definitely can identify with the story how it relates to what I've done and what I felt.
Yeah, and you know that obsession that we have, how many people's stories do you see? Let's say even up on Facebook, where they just had bariatric surgery and they want to know when they could start eating spaghetti again. Or they just had bariatric surgery and I saw somebody post that she got a Big Mac and it was okay because she cut it into 8 pieces. And she ate part of those 8 pieces of the Big Mac throughout the day or throughout the next day or whatever. And that's the patient that we see in the office that has had bariatric surgery and has lost 100 pounds and in 3 years out has gained back 150 pounds. And so we're going to talk about, which we do always talk about, that it's never about what we're picking up, it's about why we're picking it up. It's about how we're feeling that allows us to wake up in the morning and say, for today, I could behave. I could do exactly what I need to do to stay healthy and to stay happy and not to demoralize myself. And as we go through the day, seems impossible, and at 10 o'clock or 2 o'clock or 11 o'clock at night or whatever, we go ahead and use, no matter what that is. And we go to bed guilty and we wake up ashamed and we do the same thing again. And so think about it, we're practicing a behavior that makes us feel completely demoralized, and yet we do it again and again and again. Why? Because we have a problem, and that problem that we have is the same. And that problem and how we feel spiritually, or so unhappy and so out of touch and so not connected to the rest of the world, those feelings we all have. Those are, I would imagine, like I said, I only know how I feel, but I would imagine that those are exactly the same.
So when we sit in our waiting room and we discuss addiction, cross addiction, any type of addiction, it can be drugs, alcohol, men, sex, gambling, it doesn't matter what it is, it's anything that we can't stop thinking about and can't stop doing, and basically end up feeling ashamed and guilty.
Yeah.
So we are stepping into, we honestly believe recovery is possible, and we focus on the solution. So you've got a 15-second rule.
Okay, right. So we got 15 seconds. You guys, you have 15 seconds to tell us what your problem is, and then we could have the next 15 days discussing what the solution is. And so we're going to go around the room, and I'd like to know how people are feeling about what we're speaking about, because it was an assignment. No, but I really want to know how you guys feel about it. Again, this was brought up because we were talking about somebody slipping, you know, or ate some starches for 8 or 10 or 12 days or whatever. And my response to that is always, okay, that happened. You know, let's start fresh from day one. Just like with alcoholics and drug addicts, I have that same response. Okay, that happened. Let's start over again at day one. But other people, if they heard that I relapsed on drugs or alcohol, wouldn't have that. Okay, Felice, that's okay, that's what happened. And so let's start over again at day one. So even the way that we look at, even the way that you guys look at me is different. But again, the substance is different and the feelings are the same, right? The demoralization, that feeling of complete shame, and that I hate myself because I can't do this, which by the way is how we all feel, right? That we can't do it when in actuality we can. But the way that we can is by changing how we're feeling, changing our perspective so that we could change our actions. Getting skinny don't make us happy, doesn't make us happy. Getting happy allows us to stay in recovery and allows us to stay abstinent. So hi, we haven't seen you. I'm so glad to see you.
Weeks.
Yeah, you have any thoughts?
I was just thinking as you were talking about how the feelings are the same no matter what the substance is that we use. The whys are the same, and I was thinking about how people do the same thing with trauma, like they compare the degree of trauma that they've had in their life, and one person's, you know, one thing can be like very traumatic to one person that wouldn't affect somebody else, or you know, vice versa. Anyway, I was just thinking about the correlation between those two things, and that with trauma, whatever it is, you end up feeling the same no matter what the trauma was.
Yeah.
Which is the same thing with addiction. And let's see, beyond that, I'm good.
Okay, well, if you want to chime back in, let me know.
Yeah,
It's
okay.
good to see you.
Okay.
Really good to see you. So can you have enough voice to speak, or? Okay.
So I'm sitting here wondering if you guys have my house bugged, because
Well, we do, by the way. We have everybody's house bugged. We just want to put it out there.
And we spend all day watching the footage.
Yeah, because everybody's so important. Like, I know people are watching me too, right? Yeah, like.
well, I've had, I missed 2 meetings. The Dolphins had 2 games, and I had 2 big events, whatever, at my house, and well, I've eaten starch. I mean,
Okay.
like, it's,
And you're post-surgical, correct?
yes,
And how long ago was your surgery?
about 3 months.
3 months ago, and you're eating starches now.
Yeah, I'm like, yeah, like,
And why do you think that is?
I don't know.
Because you know that we had this conversation that you don't think that there's anything up as far as you being a food addict.
I know. Okay, so in my pantry, I got my daughter, those variety chip things.
Okay, so you have crap in the house and?
I have crap in the house. So I'm eating, so like each night, it's at night, like at 10 o'clock at night.
Why do you think you're doing it? Because are you doing something that potentially is going to hurt you?
Yeah, I don't know why I did it.
Right.
I wasn't even particularly hungry. I know I'm not hungry because I had this surgery, so I don't know. But each night, I went in and I had a bag of popcorn, and then the whole rationalization. Well, it's skinny popcorn. And
How do you feel about it now?
now
do you
I feel like crap, which is why I'm here. Like even one night I grabbed the baked Cheetos,
Okay.
and I swear to God, like halfway through the bag, the little bag, not the big one, but I went to the toilet and I dumped out the half of the bag, and I'm like, oh
Okay,
my
how many
God,
drug
this is
addicts have
just
done
a-
that with their drugs before?
Oh my
How many
God,
alcoholics have done that with their alcohol
I've
before?
done the same exact thing, and then I'm at the.
Right, if I put it down the toilet, I won't do it again.
Yeah,
That works, by the
yesterday-
way.
Yesterday was I good? Yeah, yesterday I was good. Friday night, I'm at the refrigerator with the things open, and I just kept hearing, I can't remember which one of you two said it, but you said, why do you have to eat this when there's so many other things you can eat? Right? Like you don't have, and then I'm like, oh my God, I gotta go to the meeting.
Okay, baby, and so you're the one who came in adamantly saying that I'm not an addict.
Well,
But
I don't know if this all means that I'm an addict.
I'm
yet.
not
I
saying
just
that it
mean-
does.
I just think it's been almost 3 months that I don't have a piece of bread or a piece of potato, and that.
Let's not talk about the substance. How do you feel after you do that?
Oh no, I
So you feel
and even my husband, he hears me because he's in bed while I'm rummaging through the pack of potato chips, and he texts me and he says, "You're failing."
well,
And I'm
okay.
like, you're failing.
Okay, so
Like,
first
oh
of
my
all,
God.
yeah. So first of all, this is about you. It's not about what I say, and it's not about what your husband says. This is about you and how you feel, right? And what's driving the behavior. And my hope for you is that as you step into recovery, which I believe that you're going to because you show up, as you step into recovery, you're going to find out what it is that's allowing you to use. Because again, if we made up our definition of addiction and we said, if I wake up in the morning and I promise myself that I'm not going to practice some bad behavior, and I practice that bad behavior, meaning it's bad for me, that I have consequences for it, physically or emotionally, that I have consequences for it. And I can't get through the day without doing it, whether it's at 10 o'clock at night or at 10 o'clock in the morning. And I go to bed feeling like crap, and I wake up feeling really ashamed about what happened yesterday. And then tonight I do the same thing. I have a problem. I've got a problem. And spiritually, that problem is hurting me. It makes me feel bad about me. Why do I do things that make me feel bad about myself and continue to do that?
It's like self-destructive.
Well, it is self-destructive behavior, but it's more than that.
Why we're doing it.
Right. It's what's behind it. It's not the behavior. It's what's behind it. So if you told me that every single day, let's say you're a cutter. You cut, okay? So now you're not eating anything and you're not drinking anything and you're not, but you wake up in the morning, same addiction. You wake up in the morning and you cut and you do something to hurt yourself because it feels better than whatever's hurting inside, right? And you go to bed and you're like, I can't believe I did that again. And you wake up in the morning and you said, today I'm not going to do it. And you do it again, you have a problem. If I slam my hand into the wall on purpose today because I'm frustrated, and I promise myself I'm not going to slam my hand into the wall, and I can't get through the day without slamming my hand into the wall because that's how I deal with my frustration, and I feel bad about it, and I wake up feeling ashamed because it's kind of stupid because I have to go to the doctor because my hand's all blown up, and I go to the doctor and I come home and I do the same thing. I have a problem. It's not that I'm slamming my hand against the wall. That's not my problem. That's my behavior. What's behind the behavior? That's how we get to the root of what's eating us, you guys, no matter what you're picking up.
And this topic is such a good topic because you said a couple of things. One is it's also the thinking. You know, my thinking gets me to the point I'm doing the same things over and over again, even though logically I know that if I keep doing the same thing over again and getting the same results, that's insanity, especially when it's hurting me, but I can't stop when I'm in active addiction and it just keeps perpetuating itself. And I find it interesting that as a food addict and a serial dieter and post-bariatric surgery, I had those conversations with myself how it was a good day or a bad day when I was in the dieting mode. I never had those conversations when I was using drugs. I didn't go out, good day today, I stay clean for the day. That was never a conversation. So it's interesting that we see ourselves when it comes to the food as good as bad, and that's the conversations that we have in our head. And I think when after the surgery, that was a lot of the shame that I carried inside of me. That when people go, oh, you've lost 150 pounds, how did you do it? And in the beginning, I started lying because that was part of the shame that I carried in me. I just couldn't turn around and say, I had surgery, it took me a while. So I just find it interesting, the terminology that we actually use as well.
For ourselves, right?
Yeah, for
Our
ourselves.
own self-talk. Yeah, for me.
I told everybody that I had surgery.
Okay.
But one of the things that, like, people are telling me that, you know, I've lost now like 55
Okay.
pounds.
Okay.
And I see it on the scale and
Okay.
I see it on my clothes, but I look in the mirror and it's a match.
Okay, so poor self-image, you guys. Anyone who's been an anorexic or a binger or a purger or an overeater, an emotional eater, how many of us have absolutely no idea what size they are?
I really don't know.
Ange, do I go shopping with you all the time and I pick something up and I'm like, does this fit me? And she's like, no. And I'm like, how can you tell? Like I have really, the body image stuff, you guys, and you guys used to laugh at me and we used to talk about me not fitting in the bathtub. Or my idea is that I won't fit in the bathtub like once I gained 5 pounds. It's not funny. It's really not. It's a funky way to live, and that is what it is. And so the fact that your body image is skewed, that's okay. That's okay. Will that change in time? I'm not sure. But I know for sure you can find out what's behind your feelings, which in turn allows you to do stuff that's hurting you. That I know. I know that you can. And it's a lot of hard work, you guys. We talk about workshop. We have a couple of people here who have been in the workshop. Everybody does a whole lot of self-discovery and a whole lot of crying and a whole lot of mending, you know, a whole lot of healing. And does it end there? No, it doesn't. We're together as a community, and we stay together as a community, and we help each other out because we're like-minded people that understand. You know, when I say something ridiculous, or when you say I have no idea what I look like, you know, join the club. That's okay. That doesn't make you good or bad or weird or not weird, or that's okay. That is. That's just an is.
Yeah, I just feel right now like I'm at some kind of low because I just keep telling myself, like that said, you fucked up, you stretched your stomach, you.
Okay, so that stuff,
You
those,
fucked it
listen,
up.
so what you're talking about right now doesn't serve you. What serves you is saying, that happened, where do I get the help? Where do I get the help so that I can get better? Every single day, every single minute, you guys, we start with a clean slate, right? We get to change our mind. We can't go back, if we can find that quote, which I absolutely love to put up, it's like, you know, although we can't go back to change the past, you know, we could start right now and change our tomorrow. that we can do.
And you know, it also takes me back to when you look at a 12-step program and it goes, the first step is my life is unmanageable, and being able to admit it, that we've got a problem, because you can't fix something that you don't have. So if we don't go, do you know what, I'm really struggling and I need help. These are the areas, for me, knowing that I've got a problem empowers me, because then I can ask people for help. You know, we've got a workshop on Saturday. We've got one of our intensive how to stop emotional eating workshops. If you're interested, just text Ange and we'll put up the link as well.
Yeah, and you know, and when you say that, I'm gonna put it super simply, okay? Again, I smacked my hand against the wall. I broke my finger. If I don't go to the doctor, I'm not gonna get a splint put on my finger. So first I have to say, wow, I think my finger's broken. Now, I think that I've got a problem. At least I think I have a problem. I'm open-minded enough to say, hey, I think there's a problem. Let me go to somebody who can help me, right? To help me heal. Same thing, you guys. We're talking about healing. And thanks for sharing that, because what you're saying, I'm gonna tell you, any single person who's gone through the surgery, who goes back to eating starches and sweets, who does have that understanding about the dopamine receptor and about, you know, chemically what's going on, and also about the guilt and the shame, that at least they're in touch with that, and about how many people are going to gain the weight back. Getting skinny doesn't make us happy. Did getting skinny make you happy?
No, it made me more miserable.
Yeah.
It made me more miserable because then I didn't have an excuse to be miserable. You know, when I was overweight and I wasn't doing the things that I could do or should do, I could hold resentments against other people, and it was all their fault because that's why I was in the position that I was in. And all of a sudden I'm skinny and I can't do that because people are telling me how fabulous I look, and it made me feel worse.
Well, I'm kind of there too. I can't even take a compliment.
Okay.
I think they're just, I thought if I told everybody I did this surgery, that it would hold me accountable, because everybody, you know, and now I think everybody's just telling me that because they feel like they have to, because they know that I did this surgery.
And
it doesn't even work. Like, I thought the compliments would encourage me, and it's not.
Okay, so you're talking about your ego not making you feel better, right? So Angeli, what's ego?
It's what you think other people think of you.
Right, somebody else's opinion of me. When I have no good opinion of myself, I'm gonna look to you to tell me, wow, Felice, you look like you lost 2 pounds. You look fantastic, you know? Or even patting me on the back for being clean. It's so funny though, we're clean, and that's amazing. And we're doing something that we were supposed to do in the first place, right? I always say that, it's like we're not pissing in the street.
Yeah.
So now I didn't pee in the street today, so I want somebody to come up to me and say, great job, you didn't pee in the street. You know, but my other folks aren't peeing in the street either. So it's about how we feel. It's not about what others see. If our brains would work that we were happy because of what others say, then I could pay somebody every single day to come over and say to me, wow, you're doing a great job and you're an awesome person and you look great and I'm so proud of you every day, and I would be happy. It doesn't work like that, Mama. I have to think I'm doing a great job. I have to know that I'm doing my best to do my best, and that's okay. I have to walk around getting some happy, getting spiritually fit. Happiness is an inside job, you guys. It doesn't come from having money, and it doesn't come from having skinny, and it doesn't come from somebody else's comments or compliments. It comes from me, the way that I look at the universe, the way that I have acceptance, the way that I'm grateful, the way that I come from a place that I come from a place of abundance as opposed to coming from a place of lack. That's what makes me happy. And when I'm in that place, I don't need to pick up because I'm feeling okay being mean today. And if I'm not feeling okay being me for the moment, that's okay too. You know, as addicts, we're so used to, I feel bad, what do? I can't sit in my feel bad. Let me use something, right? Or I'm happy. Let me use something. I'm gonna feel happier. Or it's Tuesday. How do I get through Tuesday feeling like me? I don't know how to get through Tuesday feeling like me. That's how we are when we're spiritually in active addiction.
There's so much going through my head. So when we're talking about that thinking, you know, sometimes it was better for me to feel ashamed and beat myself up with the food or with the drugs, whatever it was, because that was comfortable for me to stay there because I know what it looked like and I was so scared of change. When I went for my surgery, I was petrified. My health was failing. I was sick. I was grossly overweight. I was resentful. I was miserable. For me, it was an absolute last resort because otherwise I was going to kill myself. I mean, I was that sad and I was that depressed. So just shout out to Dr. Michael Perez, because the one thing that he did, he gave me a protocol. And when he gave me a protocol and he said, this is what you follow after surgery, can I tell you, I took that as the Bible and I stuck to it. I took that as God's word, because I knew if I kept doing the same thing afterwards, I'd get exactly the same results. So when he told me as well, certain things, you are still healing. You know, when my body at 3 months out, my stomach wasn't healed properly. They removed 75% of my stomach. Do you know what it's like to heal, to glue that stuff together again or put it back together again? And I started putting things into my body. Do you know how many people I see online that are in hospital because they didn't stick to the things that their doctors told them, because they had complications after surgery, because they went back to the old behaviors? This is not a joke. This is a major, major surgery. I mean, besides the general anesthetic, it's a huge change to our body. And, you know, we denigrate this, and I thought it would be a quick fix. I didn't realize how dramatic that change was going to be.
And thanks for saying that. And so Haiti is talking about abstinence. And we have to be abstinent to step into recovery. So if you're using and doing your best to step into recovery, it's not going to work. It doesn't work. First of all, because you're lying to yourself, right? So when you talk about following the rules, that's the same as an alcoholic not drinking. If that part doesn't happen, this part doesn't happen. Correct?
Correct.
Yeah, thanks for sharing that, because that's really, really important. Because people think, well, especially with eating, it's like as an alcoholic, do we go to meetings drunk? Yeah, some of us did. Can you eat and come to a meeting, you know, and have 16 pound cakes and come to a meeting? Yes, you can. You're going to be the only one that knows it. But you'll never find recovery like that.
Right, and if I have bariatric surgery and 2 weeks later I'm cutting up a Big Mac into 8 pieces and I'm supposed to be on a liquid diet, something's wrong in that picture.
Yeah, and having to talk about it and having to think about it and having to feel guilty about it.
Justify it and lie about it, okay? Because all of a sudden I'm doing those same things. I'm driving through the drive-thru and I'm getting it for my kids, and I'm at Publix and I haven't eaten the whole day and I've got to grab something off the shelf, and you know what? It's 4 o'clock and I've been starving, but I did eat lunch and I had something for breakfast, and all those stories, and then keeping track of it like anyone really cares.
Yeah, and she's a lying. And who you're lying to that you're hurting the most is yourself. So thanks for talking about that. That's super important. We're going to get to the people that didn't get to talk last week first. So would you like to share this morning?
No, I don't know. I just,
Yeah?
I started a few weeks ago, I guess, eating clean and failed.
Okay.
And like you said, right before I came here, I just ate McDonald's.
Okay.
And nobody would know, as
Right.
I said.
Right, so you're telling on yourself, so that's good. Because that's a good way. No, it's really important. So at least you're being truthful so that you don't have to feel bad about lying.
Like, in my closet, I have size 8s, 10s, 12s, 14s, 16s, and 18s.
Okay, anybody who's lost and gained weight, how many people have all different sizes in their closet? Okay, everybody
Yeah,
raise
so
their
I
hand.
mean, the smallest I was an 8.
Uh-huh.
Now I'm an 18.
Okay, and none of that, being an 8, if being an 8
It didn't
fixed
make
you,
me
right, if it fixed you, you wouldn't be here.
It didn't make me happy.
Right.
But,
Right, and so spiritually, what you're gonna find out is spiritually what's keeping you sick, what's not allowing you to get some happy.
but you would think that like spending hundreds of dollars on clothes, like, cause now I'm like, okay, I need 5 work pants, 5, shirts for work, everything has to be,
Doesn't matter,
I
doesn't
just
matter.
shell out the money and could care less.
Yeah, we did that buying drugs too.
You know, I find that so interesting. I just want to say something. So we'll go out and we'll fork out for all those foods that we shouldn't or couldn't or whatever.
Yeah, never think twice
Okay,
about
no,
it.
but and then we'll go out and we'll buy all the clothes so we can go bigger sizes. And someone goes, you know what? Spend $30 on a workshop and we go, oh shit,
That's so
no,
expensive.
that's
Oh my
Yeah.
God, I don't have $30, right?
Yeah.
Right,
or
let
why
me
am I
just go buy
doing
bigger
that?
clothes.
Okay.
Yeah. Yeah. Funny, the things that we decide. Remember the whole uproar about the coffee? When I said, okay, everybody that's spending $5 a day on coffee, take 7 of those 5 days and make coffee at home and come to a 2-hour seminar so that we can talk about getting to the root of perhaps what your challenge is. Thank you.
So I just wanted to also put something out there, because as an addict, when I was in active addiction, I was scared about the future. I sat in the past. I just was never in the present. So one of the things that shifted for me was making that decision not to pick up just for those next 5 minutes or the next 10 minutes or the next half an hour or the next hour, and focus on the moment and the day. If I had to think, well, for the next 3 weeks, I'm not picking up cheesecake, all I think about is cheesecake, and everyone I looked at had cheesecake faces, and it became something that was all I'm seeing and was amplified. So for me, it became focusing on that moment of time that I could manage and just not pick up for that.
Yeah, just for now, right? Otherwise, you're missing the movie, man. You're spending all of your time in your head, worrying about and feeling guilty about the things that you're doing, as opposed to enjoying what's happening right in front of you. Or if something horrible is happening, feeling that and working through it and learning how to work through it so that you don't have to miss the movie tomorrow or next month, right? So we're gonna live in today, plan for tomorrow, right? We still have to go to work, so we still have to pay our rent or our mortgage, and we're still gonna be responsible, but we're gonna live in today as we plan in tomorrow.
I want to just put something else out there. You brought up something so important. You know, our disease keeps us mute. It keeps us isolating and not speaking. The more we speak about the stuff we're thinking, firstly, telling on ourselves helps get that shame and guilt and whatever it is out there so we can move on, because otherwise we're stuck in that moment in time and it's just playing over and over again. So anyone else who's struggling to actually express themselves, go to our group on sowhywait.net. We've got a private forum. We've moved into a private space. Use the nickname if you don't want people to see you. You can still post on Facebook from there. Start speaking about the things that you're thinking about, because that stuff will keep you sick and will keep you using.
And it keeps you sick because when we talk about spiritual principles in any step group, the principle behind any first step is honesty. If I'm holding stuff in, listen, if I went to get gasoline in my car and you said, how was your day? What did you do? And I didn't tell you that I went to Costco and got gas, I'm not lying to you because I'm not hiding anything from you. But if I met my drug dealer this morning and I ate 100 milligrams of oxycodone and you said, how are you feeling today? And I said, oh, I'm absolutely great. I went to a meeting and then I went to the Costco's and I got some gas. I'm lying, right? Because I'm purposely withholding something that I know or I feel you're going to judge me about, right? Something that I feel guilty about, right? And so when we stop lying to ourselves, we can stop lying to the other folks, right? And that's part of, you know, they say the truth will set you free, and it does. It does. And so that's most importantly first about getting some happy. When I'm walking around guilty, I'm not getting some happy, right? I'm feeling horrible. Thanks so much for sharing this morning. Okay, let's go up top. Karen? I don't think Karen shared last time.
Good morning.
Good morning.
You said something very, very profound that just keeps resonating with me, and that's the word spiritual. I see your addiction, my addiction, Angela's addiction, Hades. It's all the same because inside we're spiritually broken or not doing the things we know are going to benefit us. But I struggle with, you say, do your best to do your best. Whose definition of my best am I using? Because sometimes I feel like my best for me is not my best for you.
Okay, so listen, Karen. Yes, it is. Okay, so Angela said that was spoken like a true overachiever, but it's not even so much about that as it is about ego. Karen, when I'm doing my best to do my best, your opinion of my best is your opinion, right? They say opinions are like assholes. Everybody's got one, right? That's your opinion of me. If we leave this meeting and you thought Haiti and I did an amazing job and it was the most wonderful meeting you've ever been to, and you're gonna call everybody on your block and tell them that they have to come to the meeting on Thursday, or if you leave the meeting and call Ange and say, who do they think they are? And they talk all the shit and they do it in front of people and they don't know what they're talking about. And I think somebody should call the police and get them arrested for being stupid. It's your opinion. It doesn't change how I feel my best is I showed up today and I'm doing my best to do my best. And that's enough. Stop thinking about what somebody else considers your best. That's none of your business.
That's true.
Right.
What I find myself doing is second guessing what I've done when I think I'm doing my best.
Yeah, you're
When I
beating
think
yourself up?
I'm doing something that's good for me, then I second guess, well, was that right for her? Was that, should I have not said that?
It doesn't need to be right for somebody else. It needs to be your truth. It's like the
Okay.
people that I've spoken to that said, well, I'm never going to tell anybody that I had bariatric surgery because it's going to embarrass my family. I'm never going to tell anybody that I lived in a treatment center for 196 years because my patients will find out. I don't care. That was part of me doing my best to do my best to get well. If you don't accept it, so be it. So be it. That's my truth. I'm just one person doing my best to do my best. If you love me, thank you. If you don't, okay. That's okay too.
So I'm a people pleaser, but I'm Jewish and I'm very spiritual. And for me, my guideline is the 10 Commandments. So as long as I'm not cheating, lying, or fucking my neighbor, and I'm checking my motives. Why am I actually doing this? Okay, am I doing it to please you, or am I doing this because it makes me feel good? Am I being of service because it really makes me feel good? Am I expressing gratitude or apologizing when I've done something wrong? Those are the things. So if I'm not going and actually physically hurting someone else or lying to them, but I feel bad on the inside, then I know that's about me and it's not really about anything else. And I've got to check what I'm doing and why I'm doing it. And as long as I'm happy about doing those things, things start shifting, because then that codependency from other people or on other people starts shifting. And I can accept my husband's crazy because that's the way he is and chooses to be at that moment. And my kid's crazy at that stage, and not get sucked in, which I would before, and try to fix things or lose my temper or whatever that thing is because I'm so overwhelmed. So it's given me that sense of peace, because my goal at the end of every single day is to have had a peaceful day. Because if I can have a peaceful day that's less chaotic and with less stress, and there are stresses. I've got my own business, I'm a mom, I'm a wife, I'm a daughter, I'm all these different things. Stuff happens throughout the day, but I don't need to sit in it. When I'm in recovery, I can deal with things as they're coming up, but I don't need to take on other people's stuff and try and turn into that person that I was when I was using, because the chaos is the stuff that I used as an excuse to use.
Yeah, and in one of the other meetings, they have, a reflection that you do at the end of the day. And you look at your day and you say to yourself, what did I do that was awesome today, right? And you look at your awesomeness and you say, what did I do today that I think that I could tweak and perhaps be a little bit better with tomorrow? Not what did I do today that I could pick up a baseball bat and flog myself because maybe I said something that pissed Dawn off. Okay. Okay, right? So just, what did I do? Am I showing up and doing my best? If it's my best, it's my best. Everybody else doesn't care as much as we think they do, right? Everybody else isn't paying attention as much. And if they do, that's about them. If you're doing your best and somebody else doesn't like it, that's about them and the way that they look at the world. Again, Karen, you could be the nicest, kindest person to me on the entire planet, and I could not like you. I don't like Karen, I don't like her glasses. I would never wear those glasses, and I would never like anybody who wore those glasses. Or you could treat me like crap, right? And I could think you're the best thing on the planet. Look at Karen's glasses. Anyone who wears those glasses has to be the best person in the world. You show up the way you show up. I act or see the world with my own perspective. It's not your responsibility, nor can we change somebody else's perspective. It's manipulation, and we do it as best as we can, but in the end, it doesn't work. Do we all manipulate? Yeah. Are we sitting up here doing our best to manipulate everybody to want to get some happy? Yeah, of course we are, right? It's like drinking the proverbial unsweetened Kool-Aid. Right? We drank the unsweetened Kool-Aid, and so we want you to drink it too, because we want everybody else to know what it feels like to get a little happy. What's somebody else's opinion of you, Karen, is none of your business. Show up.
Absolutely.
And
you said something very, very profound. I think you said it too, Felice, is check your motives.
Right.
And And I,
Motives.
yeah, I need to remember all
Right.
that.
Why are we doing what we're doing? Am I being kind to you because I'm being of service? Or am I being kind to you because I want you to like me? Right?
Exactly,
The
yeah.
first one, I'm being of service. The second one, I'm being manipulative. If I'm kind because I'm kind, I'm being of service. If I'm kind because I want you to like me, then when you don't call me later and tell me how great I am and tell me how you told all your family that you love me so much, and I'm calling Haiti and I'm like, do you know what I did for Karen today? I called her and I cleaned her car and I bought her some shoes and I went over and I visited her great-great-great-grandmother, and she didn't even call me and say thank you. What's my motive there? Right? Yeah. Be kind, be of service, be done with it.
Okay.
Okay? Thank you
Working on
for
that,
bringing
working
that
on
up.
that.
Yeah, we're
Yeah.
all working on that. Every one of us is working on that. Thank you.
Thank you.
Can you share today? Jess?
Can I be heard?
Oh, yeah, you can be heard.
Yay!
Yay! We're here from London.
I was worried it wasn't going to work at all, so I'm
So,
quite surprised.
Jess, you got to go London calling.
It was playing up last time anyway. So it's really weird. I don't have an awful lot to say, which is interesting for me because usually I have got something. So to sit here and just think, well, what do I want to say? My mind's come up blank.
That's okay.
So yeah, but I think I'm okay. At least that's what I'm not always in touch with how I'm feeling in the present moment. That's where I find it's difficult. Someone will ask me, a friend asked me this morning, well, how are you? And I'm like, I don't know.
That's okay. That's okay. That's okay. Not knowing is okay. If you want to share, pick your hand up or something so that we know that you're ready to share. It's really good to see you this morning.
So I just wanted to add something to what you said, because when people talk, I can relate to certain things. And when I first started stepping into recovery, first it starts with that abstinence, and for me it's the food, the drugs, the cigarettes. So when I first started, everything was sitting in my head. I was very self-obsessed, like in where are my thoughts and how am I feeling and why am I doing this, and it was very overwhelming. And eventually it starts going into a place, well, oh, there are other kinds of feelings. What do I call them? What do I name this? And because everything was either good or bad. That was the spectrum that I swung to. And then all of a sudden I was like sitting in it and trying to find out names to where I am, and not feeling anything is okay. It was such a weird thing for me to do, is to go, oh, do you know what? Things are okay in my world for the moment, because I'm so used to having so much stuff going on.
Chaos.
Chaos.
Right? All of that chaos in our heads. It's talking. That's keeping us from being in the moment. Yeah, and that's okay. So if you're having spiritually a moment where you're just feeling okay, good. That's okay. Right? We like those moments.
I guess the thing about it is, it's, for me, I sort of worry when I'm feeling like that, or when I'm, feeling is probably the word to use, because when I was numb before, it was because I was using, so I wasn't feeling then. So I guess I worry about that if I'm not feeling anything, or I'm not sure what I'm thinking or feeling.
Yeah.
So I'm trying to differentiate when it's actually okay to be feeling like that, and when I'm obviously feeling numb. There's a lot of similarities between me feeling nothing
Right.
and being numb, if that makes any sense.
Yeah, no, it makes a whole lot of sense. And our brains are pretty smart. Sometimes when we're overwhelmed, our brains are going to let us feel numb even without using. So that happens as well. So just talk about it. Make sure that you're reaching out if you have something on your mind. And otherwise, take a breath and enjoy breathing, man. Because that's okay too.
Thank you.
Yeah. Liz, good morning.
Hi, good morning.
How are you?
I'm doing much better.
Good. How's it going at work?
Work is going fine.
Yeah. Okay. And I'm not going to say I told you so or anything like that now. I'm just playing.
Yeah. So a few of you have been bringing up ego, and I have two little short stories to tell you. Friday night, I went to my first in-person kind of food addicts meeting, because I've never been to one, and I was like, well, maybe I'll see what this is about. Maybe it'll be another resource for me. And during break, everybody got up and they were real, you know, friendly and just introducing themselves to me. And this one woman walked up to me and she said, "Oh, you're so beautiful, and you'll be beautiful when you start losing weight." And I'm thinking to myself, well, you know what? I didn't say this to her, but I'm thinking, well, I've already lost a lot of weight, but it doesn't matter.
Well, it mattered because you said it.
I was able to look at that comment later and see where I've had some growth, because in the past, that would have just set me, would have been a huge trigger for me, and it's nice for me to be able to look at that and not have it set me off, and not have it like ruin my whole weekend and be like, man, who the hell does she think she is saying that to me, and blah, 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 whatever. Okay, so the second story was yesterday I was out, we were riding bikes around the neighborhood, and we rode past a group of people that were out in the street hanging out, talking and drinking, and they're like, "Oh, we like your bikes, whatever." And this lady says, "Wow, that bike has a big ass seat." And I laughed because I thought to myself, you know, in the past my brain would have turned that into, "Oh, she said I have a big ass." And yeah, I would have been really pissed off and indignant and all that stuff, and I didn't do that. And it was a relief to be able to have that experience and see it for what it was, and know how I would have responded and did it this time. So
And
that's all.
That's amazing. And those are two things that in the past you would have allowed to stay in your head for a week. So you would have allowed yourself, let's say, a week's worth of misery because of somebody else's comment, and you allowing somebody else's comment to make you feel bad about yourself. Right? Yeah, so good job, you, man.
And
good for you.
What I find interesting as well is because I would have done exactly the same thing as you. I would have had the same thoughts. And when I think about it now, these are people who are strangers that you'll probably never ever see again.
Right.
And their words have got so much importance and meaning, and that's what we make the focus. Never, not even saying, well, maybe it's about them, or that's really funny.
Right, and even when it is somebody close to you, it's okay. Again, everybody's entitled to their own opinion, right? It just doesn't need to be yours, right? You don't need to wear somebody else's opinion of you. Right? So when we have our own opinion, and spiritually we're a little bit more content as we learn to get even more content and then get some happy as we're walking through recovery. My opinion of you doesn't make you, baby. It just makes it my opinion of you. Who cares? Who cares what my opinion of you is? Who am I? Some chick sitting up here talking. That's who I am. That's all. I'm the same as everybody else. Right? Right. Thank you very, very much, because those are two really important stories, so thank you. Thanks. Ange, you didn't share last time. You have anything that you want to share today?
Not that well, the only thing I can think of, I don't know if it has to do with what we're talking about, because I haven't been really paying attention, but I've been doing
Yeah, I know.
Not, I was thinking about today's, well, it doesn't matter when, one day this week, I was talking to you about how something you said during a meeting I took very personally, and you said it more than once, and I hadn't said anything about it. And the reason I say this is because it's like, it reminds me of what Karen said, and I think even Liz was saying, and that it reminds me that we all still do that sometimes, and we have a choice. But something you had said, and I said, well, that hurts my feelings when you do that. And I said, and you asked me why, and I said, well, it makes me look bad. It makes me look like, I don't know proper boundaries or something like that. And your take on it was completely different from mine, and that it doesn't do that at all. And obviously I'm not going into the details of it, so I'm just speaking generally. But so that week, for this week, I just kind of got to see that I know I still have work to do. I was gonna say I still have work to do, and it's not that I think I'm perfect. I know I'm far from it, but no matter how long we have in recovery, there's always something we can be working towards improving in our lives. And for me, that was an important thing to see in that moment.
And it's so funny because spiritually we want to get it right away.
Yeah.
Okay, I have 3.5 seconds clean. Spiritually, I'm good. It's just like if you practice medicine, let's say. Do you ever stop learning? Does new stuff come out all the time? Do you have to be in the know about it? Yeah, you choose to, right? Because it helps you to do your job better. And so spiritually, when we're constantly working on helping our spiritual self, it helps us to do what I believe is our job better, right? It helps me to be of service to others.
And I think that the thing that kind of, I don't want to say maybe scares me is like most of the time when that happens with me, it's like, oh, I thought I was done, and I know I'm never done, but it's like, oh, where did that come from? You know, so it's always something new, different, more. I don't want to say more. What's the word I'm looking for? It's not like the same problems I had before. They're kind of a little more evolved or more, and it's a little more difficult to sort through because my brain's thinking on a higher level of
Our chaos
Yes.
is on a much higher level.
Right.
Our own bad self-talk is really up there right now.
Right.
Thank you.
So they say that we grow in recovery, and where we start, I know for myself, where I started to where I am now is so different. Karen, you've done so many workshops. Every time you do it, don't you see something different? Why do you keep doing them?
There's much more to learn and to do. I have so much work to do. I can't even, police has always equated our surgery with being in treatment. And yes, that's true. It helps with the abstinence incredibly. But then we get a year and a half out, we're like, holy crap, I want to eat that. And I did eat that. And so we don't have any recovery with that abstinence until we find you guys. And so, yeah, but there's much more work to do. That's why I keep showing up to these workshops, hoping some of it will stick.
And it always does stick. And then the next time you learn a little bit more. And then the next time you learn a little bit more, right? On that road to self-discovery, right? Maslow says nobody's ever self-actualized. And I would imagine that's true. I don't know if the Dalai Lama is self-actualized. Angela says no, he's not, because she knows him personally. But anyway, for him, that self-actualization was complete peace, right? Was complete peace. And so, do we have complete peace? No. But do we want to be as peaceful and as happy as we can? Yes. For me, it's to be of service. For you guys, that's up to your own God, up to you guys to figure out. But there's always more to learn.
So we are of service. I mean, we show up on Sundays and Thursdays, and that's what we do. And I do it because it makes me feel happy. We also had a discussion because we've got this workshop coming up on the 29th, and I just want to share. So whoever, we want to get the message out that recovery is possible. There's no one should be struggling and living with pain and in misery, because there is a solution. So for anyone who wants to participate in our workshop on Saturday, all we're asking is that you subscribe to our YouTube channel, which is Why Wait for Recovery. You get a free seat, okay? We give you a special seat.
Go up on our
And
website.
also go to our website, we have sowhywait.net. Join our forum, because it's a little bit different than Facebook. We're sharing resources. We're sharing so many different things. There are great reads, there's good music, there's meditation, there's people, whatever you're struggling with, questions, post-bariatric, what are good things to eat? It's all these questions that we live with every single day when we are in recovery, and these things that touch our life. So for us, it gives us a better format. And you know what? Your input is invaluable, because this is your space. That's what it's created for.
Right, and all of us mature spiritually differently. And so what I say here doesn't reach a whole lot of people. They don't hear me, right? Because it's not the way that they receive. And what you say might be the way that 1,000 people need to receive it right now. And so you sharing, what's inside of you and how you're working through it, and when you're scared and when you're happy and all of that stuff. If you don't want to do it for yourself in the beginning, do it to help somebody else, right? And in the long run, you're going to find that the more you do it, the less scared you are. right? And we're going to talk about spiritual recovery. We talk about the principles that we believe keep us spiritually happy. And again, that allows us to be of service to someone else. Would you like to share this morning, Ms. B?
Yeah, I was when Liz was talking about work. I haven't had like a lot of hits at work for a while, but I'm in the field a lot, and my boss was out Friday, and a higher level person was trying to find me, and I'm always reachable by cell phone, but for whatever reason, the center that I'm stationed in, apparently I heard she was calling all over looking for me. And the second I saw the cell phone ring, I picked it up. I was accessible.
Okay.
But it was like this whole trauma, and
whose drama? Your drama or somebody else's?
The other person's drama looking for me.
Okay.
And now, and so the constraint is we're gonna have you sign in and out wherever you go. So right away I was like,
okay.
But I got like, you know, I'm working, it's
They're
the
paying
job.
you?
They're paying me. So
Okay.
yeah, so it was like a whole thing, and I was doing everything I was supposed to do. I was on it, and that was the thing,
Okay.
like, you know, like I laugh with the drama. So I was really proud of myself, because normally when I have to speak with that person, I get real crazy and I start talking gibberish, and I'm like, okay, actually I'm downstairs from where you are. You want me to come up and oh yeah, that's great. You know, like the craziness. But the thing that I saw when I came home at night, I had been dealing with my friends, which is going well, but I was needing to eat dinner, and my husband had already eaten, so he didn't want to go out. And I saw like, what am I gonna eat? What am I gonna eat? And I was crazy, trying to figure out like what I was gonna eat. Can I eat something? And I told my husband, just like, let me be. I just have to find something to eat. But I see how I could have like taken whatever my boss did to me that day, and I've done that many times.
What your boss did.
Right.
Your boss didn't do anything to you.
Right.
If your boss picked up a frying pan and hit you over the head, your boss did something to you.
Right.
If your boss
Right.
has her own opinion, or she thinks you should be paid or
Yeah,
not be
yeah,
paid,
yeah.
that's about her and her
Right.
rules and the rules of where you work.
Yeah.
Nothing was done to you.
Right. So the good news is I just was acknowledging a little bit, and then I wound up eating dinner and I was happy. Like I found something that I could eat that I was really happy, because I didn't yell at my husband, actually. Like, sure, just let me be and let me, you know, decompress, and so I was really proud of myself. That was the ultimate thing.
Good job. So here's the thing, which Haiti used to say this a lot, have stuff prepped that you know that you can eat if you had a hard day, because it makes it easier not to relapse. It's like me not having alcohol or Percocet in my house, right? Yeah. Or me saying when I'm having a bad day to Angela, make sure I eat today. Like, do me a favor and call me and say, Felice, did you eat anything today? You know, when I'm having something inside of myself. So if you have stuff prepped, that's stuff that's good, clean stuff to eat that you like. It's helpful because you don't have to stand in the refrigerator. It just makes it easier.
Right. Instead of a quick thing, actually cook, because a lot of times I'll just do like quick cold.
Right, which is great, but when you're feeling a little nutsy and you could just, you know, take something out and maybe stick it in the micro or have something healthy, I think that it's helpful.
So just a couple of tips. Sunday is my prep day. So I have everything in bags in the refrigerator. I need to make a salad. It's all cut up, but it's easy to make salads. It's all there. When I buy meat or chicken in bulk, I make the marinades and freeze it like that. So it's easy to pick out the portions and just cook it. Use a slow cooker a lot. So I'll put it on in the morning. By nighttime, things are ready. So it's just really putting ourselves first. If I know I'm on the road, I pack snacks. So I know that by lunchtime, because I have certain times of the day that I get really, really hungry, I'll pack whatever it is that works for me. So it's really, it's about self-care. And when we talk about being in recovery, looking after myself, when I'm hungry, that's a huge trigger for me. So I have to take care of that side of me.
Right? Hungry, angry, lonely, tired. Right? HALT that they use, hungry, angry, lonely, tired. Those are the things that help to, and resentments help to allow us to use.
Right, so we've only got 1 minute left. We'll talk afterwards. You know, we have another meeting straight after this one. So we are going to see, we've got so many people signed up already for Saturday, but there is still room. So come join us at the workshop. Sign up at whywait.net and join our forum. Costs nothing to be a member. Sign up on YouTube, subscribe. It will help us get the message out. And do you want to take us on?
So I am so blessed and so grateful for every single one of you. Thank you for helping me stay in recovery. And I am blessed and grateful to be in recovery. My name is Dr. Felice Cellini. This was our Sunday morning why wait for a recovery community meeting?
And my name is Haiti, and I'm so blessed to be in recovery. I also want to say thank you to those who are in service with us and help us do a meeting every single week. Angelie, Ahmed, thank you. West Broward Club, thank you for this amazing space. If no one's told you thank you today, said I love you today, I love you, and
thank you.
And we will see you Thursday.
We're grateful. Peace out, you guys.
Peace out, everyone.
You get